Hello, welcome to Learn Anatomy of the Vessel, and today we'll look at a very important topic, which is the humerus. The humerus is a long bone that is located at the upper limb. The humerus articulates with the glenoid cavity of the scapula to form the shoulder joint, and it also articulates with the ulna and radius to form the elbow joint. The humerus have three parts, which are the upper end of the humerus, the shaft, and the lower end of the humerus. In this video, our focus will be on the upper end of the humerus. Here are some of the features of the upper end of the humerus. Number one, it has the head, which is smooth and round, and it is covered with hyaline cartilage that helps in articulation with the scapula to form the shoulder joint. The next is the neck. It has three necks. Number one is the anatomical neck that provides attachment for the scapular ligaments. It has anatomical neck that provides attachment for the scapular ligaments. So whenever you think of the anatomical neck, you should think of an anatomical function. So the anatomical neck has an anatomical function, which is to provide attachment for the scapular ligament. The next thing is the surgical neck. The surgical neck is seen between the greater and the lesser tubercle, and it is weaker than other proximal parts of the humerus. It is weaker than other proximal end of the humerus, thus it is prone to fracture. It is prone to fracture. Since it is prone to fracture, it means that when there is fracture to the humerus, there's possibility of doing surgery to correct this fracture. So when you think of surgical neck, think of the point that is prone to fracture, and when there is fracture, there's possibility of surgery to correct that fracture. It will help you to remember the surgical neck. The next is the morphological neck. The morphological neck is found between the epiphysis and the diaphysis. It is regarded as a true junction between the head and the shaft of the humerus. So when you think of the morphological neck, you are think of transition from the upper end of the humerus to the lower end of the humerus. So when you think of anatomical neck, you are thinking of anatomical function. When you think of surgical neck, you are thinking of surgical implication, because when there is fracture to the humerus, there is a surgical implication there. When you think of morphological neck, you are thinking of the change with a transition from the upper end of the humerus to the shaft of the humerus. With this, you can remember something when you are asked about this next of the humerus. The next is the greater tubercle. The greater tubercle of the humerus have an attachment for the following muscles that can be remembered with this mnemonic: sit. S-I-T. Now the S represents the supraspinatus muscle, the I represents the infraspinatus muscle, and the T represents the teres minor muscle. Now with the word sit, you can remember all the muscle attachment to the greater tubercle. Now for the lesser tubercle, you think of Subscapularis muscle. For also remember that the subscapularis muscle is attached to the lesser tubercle. You must remember that the word sub can be used to connote a lower thing. Example: subordinate, people low under you. So when you think of subscapularis muscle, you think of a sub, it's something lower, and it is attached to a lesser tubercle, not the greater tubercle, to the lesser tubercle. Subscapularis muscle is attached to the lesser tubercle. The first three letters here, sub, can help you think of lesser tubercle when you see subscapularis muscle and you are being asked where it is attached. Now the next thing is the intratubercular groove. The intratubercular groove, it is located between the intertubercular group. It is located between the greater tubercle and the lesser tubercle. It has two contents that can be remembered with these two letters, BC, and B represent bicep muscle, while C represents circumflex humeral artery. C represents circumflex humeral artery, while B represents the bicep muscle. The long head of the bicep muscle is seen in this groove, this intertubercular groove, and the circumflex artery is also seen in the intertubercular groove. The next thing I want you to note is that the lateral lip of this group has pectoralis major attachment there. The medial lip of this group have the teres major attachment there, and the floor of this group has the latissimus dorsi attachment there. And with this sentence, you can remember this, that a lady is a lady between two major, a lady between two major. The lady, the letter L in lady can help you remember the latissimus dorsi is located between two majors, which are the teres major and the pectoralis major. With this, we have come to this section on the upper end of the humerus. I hope you learned something new today. Thank you for watching.